conversation. I wanted to ask one more question,
Yeah.
and it's that fear and what scares you in your job, or have you been desensitized because you're dealing with, like, is there anything that still scares you, or is it all kind of?
Yeah, it's probably harder to scare me than a lot of people, but that's I think that what I would be scared of is not having the systems and team around me. That's, I mean, one of the most important. Like, you've had the experience now of coming and working in the forensic hospital, which not a lot of residents get to do. Well, I mean, I'll throw it back to you because normally I ask the questions.
Yeah, please. Yeah, of course.
But do you feel safe coming to work?
I do.
Okay.
Absolutely.
So you walked into work today and you walked past, 50 people that have killed somebody.
Yep.
Okay. Do you feel?
I feel safe.
Safe.
Yeah.
Okay.
And when you meet,
What I would become when I think what I would be frightened of is because my role is to ensure that all those systems are there so that everyone's safe. And if I kind of let that down and colleagues let each other down, that's when, things could go wrong. And, whilst things could go wrong, despite the best intentions, I think that in many ways having that safety and security, it's actually one of the safest jobs, but one of the reasons for that is because of all the thinking and planning
and money.
And yeah.
It does cost a lot, but it's important.
Yeah, it probably doesn't cost as much as a lot of other medical units.
Really?
Of similar size.
Really?
Well,
oh, wow. That's surprising. I thought, yeah.
Like an intensive care ward or something.
Yeah, that's true. They do a lot of
per
treatment.
bed.
Yeah, that's
or something.
right.
Yeah,
That's a good point.
It's
because
more
you're not doing all these incredible, invasive treatments that require all this monitoring.
Yeah.
It's
we're probably the most expensive psychiatric intervention, but not
medical.
Not medical. No,
that's a really good point.
And per outcome, which is I think why the reason forensic hospitals have existed for well over 150 years is that and lots of other hospitals in medicine have come and gone, is that they're highly effective. I think that what would frighten me is if we allow that sort of prejudice that was talked about before to come in and sort of say this is a population not worth worrying about, not worth providing care to, and go to either a neglect or a punitive approach to managing people with mental disorders and violence, and then actually we'd be in a much worse situation where things would be dangerous. And
well, off of that, how many people do you think in correctional complexes should be in mental health facilities?
A lot of them.
Yeah. So we actually need more resources and more beds.
Yeah, well, I think we need to realign things in society.
What do you mean by that?
There's a lot of, like for example, the current, in New South Wales, there's been an inquiry into ice use, and the government's now, and there hadn't been any sort of response to that, and the government's now looking at, instead of putting an ice user in prison, giving them a delayed fine and sending them to treatment instead. And I think that approach is much more likely to yield benefits for society and that person, whereas sending the person to jail for using ice probably will mean that they are released and they reoffend. Whereas if they go into treatment, they're
a better
more
chance.
likely, there's a better chance that they won't reoffend. Now that takes away some of our innate desire to punish. But I think we need to think more carefully about, what we do as a society, and the outcomes. If we have someone with psychosis and criminal behaviour, if we send them for treatment, and it can be secure treatment, the outcomes are much better than if we punish the person.
Hey team, thank you so much for checking out that highlight clip from the Doctors Getting Coffee podcast that I run. If you want to see more clips, you can check out my YouTube channel, or if you want to listen to the whole thing, check out your favorite podcast app. If you want to support the podcast, consider buying us the next coffee at buymeacoffee.com/Dr. Sil. You can also join us as a YouTube member or a Patreon and get access to the full video podcast episode. Or you can just jump onto our Discord server and we can chat one-on-one. Thank you for your support, and I'll see you in the next video. Bye for now.